Thank you for joining us for what is the final session of the CRCR representative preparation. And so what we're going to do today is a little different than what we've done in the past. We're going to give everybody a few more minutes to join, since I'm still seeing everybody join right now. We are going to ask that you please not share your screens and stay off of audio. We are, as all the other sessions have been done, is being recorded and will be available on the YouTube the Florida YouTube channel. Govi is joining us today. Thanks, Govi, to man the chat. So if you have questions as we're going through, please put it in the chat. But we will look at answering most of those at the end if you have any questions. Certainly, Govi, if there's any technical issues or anything, just stop me during the presentation, please. So it looks like we have a few more people join. What we're going to do today, the intent really is for you to analyze how prepared you are to take the exam. And so we are going to revisit some of the questions that we did in the prior sessions. And then I have a whole new round of questions across all of the 4 units for you to determine, do you know the answer and how many are you getting right? There's approximately 55 questions. So what I'd recommend that you do is, as you answer the question, write down whether you got it right or wrong to determine if you will pass more than the 70%. Because of we're just doing questions, we're not going to do polling. So I'm going to give you about 20 seconds or so to see if you know that answer. And then I'll share with you what the results are. This will also again be posted on the HFMA website. So you have reference to this as well. The exam is, again, it's 75 questions. They will be randomly drawn from a much larger pool of questions that covers all of the material. You will have 90 minutes to complete it. Once you start it, you are set. If you don't complete it, you'll fail it, unfortunately, and then you have to wait another 30 days. So make sure you're ready to take the exam and you commit to that 90 minutes. If you studied, I guarantee you it will not take you 90 minutes. I ran through the exam a few weeks ago myself, and I was pretty much done in about 30 minutes. You can flag questions. So if you're uncertain, you can go back and look at those questions again and make another determination. But you will have more than enough time. But really today's session is intended for you to look at the question, jot down your answer, think about it, and then we'll release it, and then you can determine. This will really show you, will you pass? Again, it's a 70% passing score. And if not, what are the areas that I need to focus on that, those concepts for? All right. So again, any questions that Govi know, and we'll get started now. All right. So first questions. What happens during the post-service stage? Remember, we have pre-service, time of service, and post-service within the revenue cycle. Okay, correct answer is the third and final major segment of the revenue cycle. So it's the final coding of all services, the preparation of the claims, the payment processing, and balance billing and resolution. So the correct answer is number 3. The segment includes the account activities that occur after the patient is discharged until the account reaches a 0 balance. Next question. Which item is not best practice for patient-friendly billing? Answer number 2. You should never report to health care plans when the patient account is transferred to a collection agency. It is really none of their business if your insurance company knows whether or not you didn't pay your bill. All the rest of them are part of the HFMA patient-friendly billing project that was released, probably 10 something years ago. So there you go. Third, which option is not a main healthcare dollars and cents revenue cycle initiative? Okay, correct answer is number 2. Patient financial communications, medical account resolutions, and price transparency are all components of the HFMA initiatives that have been put out there in the industry. What is the objective of the HCAHPS initiative? Correct answer is number 1, to provide a standardized method for evaluating patients' perspective on hospital care. Of note there really is only one question within that entire questionnaire that is related to revenue cycle. Obviously, they conduct evaluations concerning patients' perspective, but that's not their objective. Okay. Which is not a department that supports and collaborates with the revenue cycle? Correct answer is assisted living. That is a non-acute care residential service, typically part of the continuum of care for a select group of patients. All other listed clinical services, finance, and information technology are all key partners that needs to work with the revenue cycle to make sure it's effective and optimized. Which option is not a continuum of care provider? So correct answer is health plan contracting. Physicians are always part of the continuum of care for the patient. Skilled nursing facility is for more non-acute, but where patients still need skilled nursing capabilities and assistance, typically after an event like a surgical event, types of strokes, things like that. And obviously, hospice is used for patients that are in end of life care, where they will no longer treat the patient for the condition, but will keep them as comfortable as possible. Okay, health plan contracting is not a continuum of care provider. Which of the following are not essential elements of a compliance program? And this was a question we had in one of the original units. And I will share with you on this one that there are actually two correct answers on here. In the testing, you will only have a choice for one. So before anybody asks that again, I didn't modify this, but the two that are not essential elements of a compliance program is the automatic dismissal of any employee. There should be a structure and some, components about that employee that is excluded from participation, but it does not necessarily state that they have to be fired. And then a compliance officer should not be employed within the billing department. The compliance officer is usually very independent, high level within the organization, and so that they can be independent, typically reports to the board. So a compliance officer needs to be in place, but they shouldn't be in the billing department. Okay. All right, my computer decided it doesn't want to move now. What is believed, and I can't seem to spell anymore, to be the backbone of a compliance program? Okay, so the correct answer is the code of conduct. All others are components of a thorough compliance program, but the code of conduct is believed to be the backbone of the organization's compliance program. The code of conduct, if implemented effectively and enhanced as needed, can reduce weaknesses by helping employees and agents understand their roles and responsibilities. What is the transaction code set for referral, certification, and authorization? I'm going to put Govey on the spot later and see how many he got right. You got to be honest too, Govey. All right, the correct answer is 278. 834 is for the enrollment and disenrollment in a health plan. 820 is the health plan premium payment. And 276 is the health claim status request, with 277 being the response. So identify which option is not a work plan task mentioned in the course. And we're still talking about compliance here, if that helps you any, and the OIG work plan task. Okay. Correct answer is number 1. The reconciliation of outlier payments enables Medicare contractors to perform final settlement of the hospital's associated cost reports. All others, as you can see, is things that denials and appeals in Medicare Part C, Medicare payments made outside of the hospice benefit. Keep in mind, the hospice is responsible for all payment for services that are relative to the hospice condition. So they will look at any payments that are made outside of that to ensure it is not. And then certainly denials and appeals in Medicare Part D. Keep in mind, Medicare Part C is your Medicare Advantage program. It's also referred to as that. And Medicare Part D is your prescription drug benefit. In order to promote the use of correct coding methods, CMS developed what? Now that I look at the question and the answer, I'm hoping 100% of you get it right. Should be pretty obvious. So the correct answer, obviously, is the Correct Coding Initiative. Should have played some words with that. It's to ensure that the most comprehensive groups of codes, rather than the components parts, are built. Okay. What is not an ethics violation example? Okay. The correct answer is duplicate billing. Duplicate billing typically does not happen because somebody is trying to falsify it, and typically duplicate billing is just through errors in billing. Some providers will submit second bills if it's not paid, not the most appropriate way to do AR follow-up, but all the others are examples of ethic violations. Additional examples are of theft of property, falsifying records to boost reimbursement, and privacy violations. What do business organizations' ethics represent? Okay. Correct answer is number 2. In healthcare, both clinical and financial personnel must be fully aware and engaged in the laws and regulations that govern their work. Business or organizational ethics are relevant to the conduct of individuals within an organization. Okay. What does the hospital value-based purchasing provide? Okay, correct answer is number 3. The physician quality reporting is number 1. Hospital readmission reduction program is number 2, and the Affordable Care Act is number 4. What is the intended outcome of collaborations made through an ACO delivery system? Okay. The correct answer is number 1. And reading the questions, I could see that it would be very easy to choose any of the other ones. And part of them is more of the objectives of it. What are things that they're going to do as part of it? But what is the intended outcome is to the answer is number 1, which is by meeting established benchmarks for quality and efficiency, participating organizations may receive a share of the savings generated by reducing duplicative services, improving productivity, minimizing paperwork, and other cost efficiencies. Again, a lot of these questions came directly from the HFMA units. And if you want to, if you know, what you can do is you can answer the question, see if you got it right. You can actually go back and answer it multiple times to see their explanation as to what the correct answer is, particularly in some of these that are a little bit more nuanced as they're answering them for you. So just a trick that you can look at here. What is not a value that is used to estimate net receivables? Where AR management starts with gross receivables, and then things are used to estimate net receivable, things will be removed from that. Okay, correct answer is cash. Cash is actually an accounting method that records revenue when payments are received. To estimate net receivables, the following reserves are estimated and deducted from gross receivables: your contractuals, any self-pay adjustments you offer to your patients, your bad debt, your charity care, and possibly other allowances. For example, maybe VIP, courtesy, employee discounts. We rarely see those anymore, but they still do exist. Reserves for bad debt are estimated by considering the health plan groups and the age of the receivables. For example, self-pay accounts may be fully reserved or at 100%, 120 days from the first bill. Okay. What is an example of a non-acute patient type? I have to admit the silence is killing me. But okay, so the correct answer is skilled nursing. Skilled nursing is a non-acute setting, and patients are admitted into SNFs when they no longer meet the criteria for acute care, but still need an inpatient level of skilled nursing or rehab services. Observation is an acute, unscheduled patient type. Routine diagnostic is acute scheduled, as is recurring services. Okay. How many days must a patient be an inpatient in an acute hospital, if I'm clear on that, for Medicare to pay for a SNF? So before a patient can be transferred to an acute care, to a SNF, and for Medicare to pay for it, what is the qualifying number of days for them to be in-house? Okay, correct number is number 3, 3 days in the hospital. Now, I will tell you that there has been some leniency this past year due to COVID, right, wrong, or indifferent. And you may be encountering within your own facilities that patients are being transferred to SNFs prior to those 3 days. So just to keep that in mind, but the standard normal regulation was 3. Okay, and I would expect we'll go back to that under when we're back into normal circumstances. What is the intent of the patient reminder after scheduling? Correct answer is 3. Provide the patient with a written list of the patient's responsibilities before their appointment. It'll usually include things like prep, don't eat before, what time to show up, and may even include things like where they should park and where they need to present for services. All of the other answers are components of the scheduling process. Okay. Which exam requires a physician order? Just so this is primarily for Medicare beneficiaries. However, other insurance companies may have very similar requirements in place, but specifically, this is for Medicare beneficiaries. Okay. The correct answer is a CAT scan. Tests and services can only be provided with a valid physician order. And that's true for every commercial payer. With respect to Medicare beneficiaries, they do not require physician offices orders for flu vaccines, pneumonia vaccines, screening mammography, and there are some preventive tests that also do not require a screening mammo. But primarily, most will require an order, particularly a CT scan would require that as well. Okay. Name the guideline that Medicare established to determine which diagnosis, signs, or symptoms are payable. The correct answer is number 2. Medicare and other health plans will only pay for tests and services that are determined to be reasonable and necessary. Medicare has established guidelines called local coverage determinations, or LCDs, and they also have national coverage determinations, NCDs. Other health plans may have their own notice of non-coverage that would need to be evaluated by providers if those are actually published. What we provide to a patient if the diagnosis, if they're not covered, is an advanced beneficiary notice, or an ABN. If a Medicare patient is not presented with an ABN and it is a non-covered service based on those LCDs, you may not bill the Medicare patient. So proper, processes with respect to ABNs is really important as part of this prior to the service. Okay. What is the purpose of insurance verification? Okay, I think this was a give me 2, I hope. Number 4, during the process, coverage issues are identified and communicated to the patient. Insurance verification sets the stage for the completion of financial education and account resolution based on deductibles, co-insurance, and other coverage limitations. Okay. When is Medicare the secondary payer? Okay. And just so I think everybody on the call should know this, EGHP stands for Employer Group Health Plan. think most of us know that mnemonic, but I wanted to clear that up. ESRD is end-stage renal disease. Okay. Correct answer is number 1. Premise accidents are not primary to Medicare. So if I get hurt in my own home, then it is not primary. The liability payer is not going to be the primary. Yep. The other one, ESRD, if they are within the 30-month coordination period, then that Medicare is secondary. Medicare, once they have met the 30-month coordination period, then Medicare is primary. If the patient has an employee group health plan and they're working, they must have more than 20 employees. And if they have it via disability, then it must have more than 100 employees. Okay. Which health plan covers uniformed services members? Again, I hope this one's a relatively easy one as well. The correct answer is number 2. TRICARE, formerly known as CHAMPUS, is the Uniformed Services Healthcare Program for active duty service members and their family, retired service members and their family, members of the National Guard and Reserve and their families, survivors, and others who are eligible. TRICARE plans include TRICARE Prime, TRICARE Standard, and an Extra, and TRICARE for Life. Okay. Which Medicare plan offers drug coverage? Medicare Part A, B, or C, or D? Okay. Correct answer is Medicare Part D. Medicare Part A provides benefit coverage for inpatient hospital services, skilled nursing, and home health. Part B benefits are available for outpatient and professional service coverage. Part C is also known as the Medicare Advantage Plan, which is Part A and Part B combined and may include Part D. Part D is also known as the Prescription Drug Coverage Program. Okay. How many lifetime reserve days does a Medicare patient have? Okay. The correct answer is number 2. After the 60 full and 30 coinsurance days are used, the beneficiary may opt to use 60 lifetime reserve days. Again, opt so that they have to be asked to use them. Lifetime days are used once in a lifetime and they never renew. Once the full benefits, coinsurance days, and lifetime reserve days are used, the patient no longer has Medicare Part A coverage. What is the timely filing for Medicare? Okay, and speed this up a little here, guys, so we can make sure we get through everything. The correct answer is 1 year. You try to file that claim at 366, you will get rejected. There are no appeal rates. So watch that timely filing. A good example would be if a patient does not respond to you and at day 366 calls you and says, look, I have Medicare. My recommendation to you is don't bill it. You won't get paid. And they will tell you that Medicare, the patient cannot be billed. Very cautious about that. Find the insurance up front. What is not a category that meets Medicaid requirements for coverage? And keeping in mind, you need to meet the required federal poverty level or income requirements, but you also have other categories that you need to be in. Correct answer is number 3, unemployed. Now you may be unemployed, but that fact by itself is not sufficient. To be eligible, an individual must meet income and asset requirements and fall into one of the following major categories: children, pregnant women, adults and families with dependent children, individuals with disabilities, and elderly. Which contract type divides outpatient services into procedural groups for reimbursement? Keyword there, outpatient, if I can give you a hint. Okay, correct answer is number 3, APCs. DRGs are inpatient. Case rates establish a single payment for all services provided to a patient, and package pricing includes a single bundled payment to hospitals and physicians, typically for things like cosmetic surgery and maternity services. Which is a component of the CMS Price transparency rule? And Govi, you better get this one right. Okay. Most providers now are dealing with this and scrambling to meet the mandate for January 1st. I think everybody was hoping it was going away, and I don't think so. All right. Question. The answer is number 2. The CMS mandate has 2 primary requirements: comprehensive machine readable file and the consumer friendly shoppable services. For hospitals, posting their charge master has been around for some time now. Not that it's helpful in any way, shape, or form if you've ever gone through and looked through some of them. And the contract rates min and max are a component of the comprehensive machine readable file. Okay. How many shoppable services are mandated by CMS? Okay, the correct answer is number 470. Although they have to put up a total of 300 shoppable services, only 70 specific CPT codes are mandated by CMS. The other 230 is based on volume at the provider. Okay. What is the first step you should do in financial counseling? Okay. Correct answer is number 3. Greet the patient and give them your name. All the rest of them that needs to get done, but you think, you look at this and go, oh, that's too simple. No, that's the correct first step you should do in financial counseling. What is not a best practice in patient financial communications? Correct answer is number 2. EMTALA strictly restricts the provider from delaying care until financial obligations are discussed. All the others are components of best practices in patient financial communications. Which physician writes the admission order and is in charge of the patient's care for a period of time? Correct answer is the attending. Primary care is usually a family practitioner, OBGYN, pediatrician. Referring is typically a primary care physician refers to a specialist for care beyond their scope. And then consulting is when the attending physician brings on other specialists to consult for specific areas of concern. Okay. Which is not a condition of admission form. Correct answer is privacy notice. Conditions of admissions include medical and surgical consents, release of information, financial agreements, and assignment of benefits. The privacy notice that's included in admission forms is issued to implement the requirements of the HIPAA Act of 1996, and it addresses the use and disclosure of an individual's health plan information, but it is not a condition of admission. If the patient will not stay more than 2 nights, what is the right admission status? Okay, I'm going to have to start going through these a little faster. Correct answer is observation. Please refer to the 2-day rule in the courses for more information on this. Which case management review is done during service? Correct answer is concurrent review. Prospective review is done before service. Retrospective review is done after service, and concurrent review is done during service. Concurrent review and discharge planning is during service. Which modifiers are used to designate an anatomical location? Correct answer is level 2. Level 1 can discuss common scenarios such as bilateral or multiple procedures. Level 3 modifiers differ significantly because they are assigned by each MAC, but level 2 will designate a right or a left side or a part of an eyelid or a hand or an artery. What information is not part of an EHR? Correct answer is past payment history. The EHR contains medical and treatment histories of patients, and it is the connection of the clinical documentation process to the coding and charge process that supports claim generation. What billing format is used to electronically submit professional claims? The correct answer is number 2. The electronic version of the UB04 is called the 837I, and the electronic version of the CMS 1500 is called the 837P. What is the definition of a clean claim? The correct answer is number two. Providers should attempt to receive the highest clean claim rate, best practice being 95 to 99% of all claims require no staff touching by putting robust edits in both their HIS system and in their clearinghouse. Which code provides additional information pertaining to the period being billed on the claim? Okay. Correct answer is number 2. Occurrence codes can provide additional information to the period being billed on a claim. Condition codes are used to describe condition or events, and occurrence span codes would be used for an event that spans a period of time. And value codes and dollar amounts represent data of a monetary nature. Which is not a factor to meet criteria for SNF coverage? Correct answer is number 2, needs care for at least 100 days. Typical SNF stays are around 30, but there's no requirement, but that's your typical. And a patient is eligible for 100 days of care in a benefit period. What is the intent of the Medicare Bundled Payment Initiative? Correct answer is number 3. The Medicare Bundled Payment for Care Initiative is designed to align incentives between hospitals, physicians, and non-physicians. An example would be the comprehensive care for joint replacement. What is the first thing you should do in the cash posting daily reconciliation process? Correct answer is number 3. Cash handling opens the potential for fraudulent activities and requires control to ensure the safeguarding of cash flow. We've gone through in the past all the controls that you need to include in that, but the first thing you should do is obtain the total of all payments. What is a network of money movement available to banks through the Federal Reserve System? Okay, correct answer is electronic fund transfer, or routinely called EFTs. It's a electronic transfer of funds from payer to payee through the banking system. What is not a reason for credit balances? Correct answer is number 2, insurance takebacks. They typically result in a debit balance because they're taking prior money away. And I usually see they pay less than more. So that is not a reason for credit balances. When is the claim rejected? I think in the industry, we use the terms rejected and denied very loosely with multiple definitions. So this, again, you want to make sure you review this that section very closely. Correct answer is number 2. The first thing a health plan does when processing a claim is to see if the patient is covered. They are then going to look at the claim date to ensure that the dates of service is within the coverage dates and all data on the claim matches what on file. Typical rejection reason you'll see is member not found, patient not eligible, things like that. So again, better edits and better insurance screening is important for those things. Make sure edits are basically going to be your clearinghouse typically, and other 2 are denials after the claim is adjudicated. It's not considered a rejection, it's considered a denial. What is the mission of the RACs? Correct answer is number 3. That is their purpose. A process they will follow will be notifying the MACs to take the money away, and the MACs take back the money from the provider, and there is no notification directly to CMS. Okay. What does waiver of liability refer to? Correct answer is number 2. If the Medicare beneficiary had knowledge of should have been knowledge, they can be billed. If neither the patient or provider knew or reasonably could have expected that Medicare to know Medicare is liable, and if the provider should have known or did not inform the beneficiary, then the beneficiary may not be billed. I'll try to get through these here because I see we've got some questions. What is effective receivables management? Okay. Correct answer is number 3. All others are components of an effective AR management. What is not a component of patient balance after insurance? This should be pretty easy, I'm hoping. Okay, in the interest of time, I'm going to go through this pretty quickly. Correct answer is insurance receivables. Managed care contracts and state and our federal regulations prohibit the provider from pursuing open insurance liabilities from the patient. Deductible coinsurance and co-payment are all standard patient liabilities. Which regulation pertains to community health needs assessments? The correct answer is 501R and is required in exchange for the federal tax exemption. What is the intent of Title VI Fair Credit Reporting Act? Okay, correct answer is number 3. Protect consumer rights. It has exact standards. Okay. What is not a criteria for evaluating agencies? And I have to think that you're all going to get this one right, please. All right, so correct answer is presents they send your staff for Christmas. Although they're really nice, it's probably not the reason you should choose an agency, or where they take you to dinner, or how often they take you golfing. Results is more important than any of those things in revenue cycle, I would hope. Okay, what is a disadvantage of outsourcing? A disadvantage of outsourcing. Correct answer is number 3. Increased cost if the vendor is not effective. All others are advantages of using an outsourcing agency. And we are out of questions. So Govi, are there any questions on the chat? I saw some coming through.
Yeah, absolutely. There's 2 questions that came through. One is from Lisa. Her question was around one of the Medicare questions that you had brought up. It wasn't the timely filing one. I think it was the one before that, around Medicare Part A, B, C, D. I'm not specific what the question was. She just wasn't I think what the answer is for that question.
For the prescription drug coverage?
I believe so, yes.
Correct answer is Part D.
Right, okay.
Yep.
And then there's another question around, is there a good day of the week or time to take the exam to avoid technical difficulties with the HFMA site? And if we do experience technical difficulties, is there a process or person to contact?
You would just call the 800 number. You can also, if you happen to do it during the week, you could probably email Shirley Heveland. If you did it during the weekend and something really happens, email Shirley Heveland at careerservices@hfma.org. Let me know as well. And so I'll see if I can work with Shirley if you really do have some technical difficulties. I took it on a Sunday and I had no issues at all. So I would expect you're going to be okay, but certainly internet issues and things like that happen. Just be prepared to, possibly document it.
Okay, thank you. Question from Victoria. Can you go over question number 2? I think that's what she's asking.
Go over all question number 2?
I believe so.
Okay, let me go change this so I can see what the question is again. Sorry.
And I apologize, Christine, I have to drop, but I'm going to have Diane. There's a few more questions that trickled in.
Okay.
Diane's going to take over for me. Thanks so much. Appreciate it. Yep.
Yeah, sorry guys, my computer's seeming to hose here. So number 2. Which item is not best practice for patient-friendly billing? The correct answer is report to healthcare plans when patient account is transferred to collection agency. You should never do that. You need to do all the rest of it.
Okay. So another question, which is a component of the CMS Price transparency rule? They missed the answer to that one.
There are 2 components. There are 2 components of the price transparency rule. The first one is the machine readable format. The second component of the price transparency rule is the 300 shoppable services.
Okay.
Okay.
And then another one, do you feel like these questions are comparable in difficulty compared to the test?
Yeah, I do.
Okay. Will all these questions be on the test?
Nope. Representation, there will be 75 questions given to you during that 90-minute. It is going to come from a very large pool of questions.
Okay.
Okay.
And then can you go over slide number 41 again?
And then after that, Diane, we're gonna have to, I do have to another call, but
Yes, ma'am.
what billing format is used to electronically submit professional claims? 837I or 837 institutional. The paper copy would be UB04. 837P is professional, and the CMS 1500 is the paper format.
Okay. And then Christine, before we close it out, are these true and false questions on the test or
No.
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 Okay.
No true and false.
Okay. And for regarding the PDF, is it possible for you to highlight the answers to the questions before we publish them? Publish it?
Yeah, you're gonna have to give me a day or two though, okay? So
Yeah. Perfect.
Until maybe Monday.
Perfect.
Okay, I'll be happy to do that.
Sounds good.
Either that, Diane, I don't have a problem with it. If you want to publish it as a PowerPoint and the answers are all in the notes.
Okay.
I don't have a problem with that at all. If you guys want to pull down a PowerPoint, the answers are all in the notes.
Okay.
Okay.
All right.
Both. Okay.
Okay.
All right, guys, I'm going to jump. Any questions, feel free to send them from email. My information is out on the HFMA website, so feel free to contact me with any guidance or any additional questions that you prepare for the test. If you study, I guarantee you will pass. Okay? All right, thanks, guys.
Thank you.